Hi, my name is Erica Alexander and I am one of the faculty here at Blessing Riemann College of Nursing and Health Sciences. Today I'm going to show you how to change a central line dressing. Please note that this procedure is the same regardless of the type of central line that your patient has. So first you need to gather your supplies. The supplies that I'm going to need are a sterile towel, a ChloraPrep to clean, sterile gloves, clean gloves, a bio patch, one that is new and in its package, a Tegaderm, 2 masks, couple saline flushes. This will depend, how many saline flushes you need will depend on how many ports your patient central line has. If it has 1, 2, or 3, maybe even 4. So however many ports that you'll have, you'll need that many saline flushes. Ours has 2, so I have 2. And then you'll need the injection caps, your Lurelock injection caps. You'll need the same amount of these as you do saline flushes, so I have 2. And then you'll need some alcohol impregnated caps, and you'll need these for however many ports of that central line are not being used, so which ones aren't hooked up to IV fluids. In this case I need 2 because neither one of our ports are hooked up. After you've gathered your supplies, you're of course going to do your hand hygiene, do your AIDA, explain the procedure to your patient. Now I'm going to start preparing my supplies. I'm going to start with setting up my sterile field. You could start with preparing your saline flushes and your injection caps. That would be perfectly fine as well. I'm going to set the items off to the side here so that way I have room to prepare my sterile field. Make sure that this is a clean working surface, and remember all of your principles of sterile technique when you are preparing your sterile field. So when I open the towel, I'm going to open it away from me, to the sides, and then down. Then I'm going to find the corner in here, grab by the corners, put it down, that. And then I'm going to go ahead and drop the supplies that I need on here, which are my ChloraPrep. Remember to open away from you and that the outer package cannot touch the field. And you can throw the outer wrappings into the trash can. Make sure you don't touch the inner wrappings. Remember, it's okay if your stuff falls on top of each other. You can adjust that later. And then I would also open up my bio patch. This would of course be in a closed sterile package that you would have to open up and drop on as well. Now I'm going to go ahead and prepare my injection caps. So I'm going to put my stuff to the side so I have a little bit more room. So for each port on the central line, we need to change the injection cap after we clean and put the new dressing on. But these caps have air in them, so we need to make sure to prime them to get all of the air out. So to do that, I am going to open this up by peeling it back. And you can see with this particular one, first of all, notice that I'm not doing this right over the sterile field. I am stepped back from it just a little bit. I want to make sure to not touch the inner wrapping of the package because I want to make sure that the ends of this catheter, the end of this cap, remain sterile. Now when I pull this one back, I can see that there's a cap here. That means that's the side that connects to the patient, and I need the side that connects to the saline flush. So depending on the brand, the type of the injection cap, when you open it, that may be what happens. So the easiest way to work with that is you can just take this whole thing off. You can pull it back to the side, but you're going to be better off just to take that off and keep your fingers on the outside of this package here on the plastic. Get your saline flush ready. Make sure that you've got all of the air out of it. And then making sure that your fingers, the plastic's covering that, you can pull that in back, again keeping your fingers out here on the edge, and you can connect this. You can go ahead and then move it off to the side. I would hold it so I'm not over my field, but so that way you might be able to see it a little bit better. I'm going to be over here, but make sure that you're not over your sterile field. And you're just going to slowly flush, and you will see the fluid come out the end. You may or may not be able to see that here, but there is a drop of fluid coming out the end. To make my life a little bit easier later, I'm going to go ahead and take this little cap off, set it to the side, and then this goes back inside the package. You can leave that syringe connected, and now we just want to make sure that that tip doesn't become contaminated, so it stays right inside that sterile package, which is why we made sure that we didn't touch the inside of that package. Because if we touch the inside of the package, then it would be contaminated and we couldn't do that. So I'm going to get my next one ready. Pull this one back. You can see the same thing. The cap's in the wrong spot. This time I'm just going to leave this outer. As long as you be careful how you touch it, you can leave that outer wrapping on too. Prime that one as well. And this one, the cap's not wanting to come off. So I'm just gonna leave it on there, and I'm gonna set it here because I can get it later. So now that I have my caps ready, I'm gonna scoot these alcohol caps over just a little bit so that way I have plenty of room to open up my sterile gloves when I'm ready to do so. At this point, if I have not done so already, I need to put a mask on my patient and a mask on me. We want to make sure that that we have these masks on before this dressing comes off of our patient, because then when that dressing is off, you have more likelihood for contamination. So we want to make sure that our mouths and noses are covered at that point. So your patient would need to have a mask on. You would need a mask on. I'm not going to put it on so you can hear me, but I would have a mask on as well. You can put the masks on as soon as you get started. That's perfectly fine to make sure that you don't forget, but they have to be on before you take that dressing off. So now I'm going to start preparing my patient, and first thing I'm going to do is take this dressing off using regular gloves. So with my regular gloves on, I'm going to remove this dressing. When I do so, I'm going to pull it in the opposite direction of the central line. So since it's hanging this way, I'm going to go the opposite direction. That just makes it a little less likely you're going to tug on it. There would be an old bio patch on there. You would need to make sure that you remove that as well. You're going to inspect your site, make sure there's no redness, no tenderness, any swelling, your normal assessment to that. Once the old dressing is off and you've done your assessment, you can take those now dirty gloves off, do some hand hygiene with some alcohol foam. You should be able to get some within reach without walking away from your sterile field, and then it's time to put your sterile gloves on. Now remember, when you're opening your sterile glove package, you want to make sure that you're not going to open into your sterile field. So we're going to stand perpendicular. You're going to get those. You can kind of bend them over the table like that to get them to stay open. If they don't want to stay open, that's okay. That's why you're making sure that you only hold these on these flaps, because what you can do is I can hold this with my contaminated hand here as I pick that glove up. Remember, I'm going to pinch the cuff of the first one and get that glove on. And now here what I can do is I can pull that by that flap, hold that over while I pick the glove up, and then I can let it go down. Just make sure when you pick the glove up, it doesn't come back and hit you on the hand. So remember that you're going to put your fingers underneath of the cuff and put those on. Now that I have my sterile gloves on, I can come over here and arrange my supplies however I want to make them a little bit easier for me to get to. Then I'm going to use the ChloroPrep to clean. When you're to activate this ChloroPrep, these little wings here, you're going to squeeze those, you'll hear a snap, and then the liquid that's inside this plastic tube will start to flow down to that pad. If it doesn't get started right away, to help facilitate it getting started, you can squeeze that, push it on your hand, your gloved hand, because you're sterile, to get that started. To clean the central line, what you're going to do is you are going to do a friction scrub. You need to do so for at least 30 seconds. You need to make sure that you are getting an area that is as big as what that dressing is going to cover. You also want to make sure that you get underneath of the central line. What you can do for that is you can come and you can use your non-dominant hand and pick up the lines, Just make sure you are far out. You don't want to pick them up real close to here. You can pick them up out here And you can get underneath of that, so that's good and clean. And then you also want to get down the line. Now keep in mind, your non-dominant hand is now contaminated. And when you're coming down here, basically go about the clamps and you'll be good. So once you've done that for at least 30 seconds and gotten, again, an area as big as what your dressing's gonna be, as well as down that line, you're done with that. So you can throw this into the trash can. Then we need to make sure that we give this time to dry. After it's had time to dry, you're going to put the new bio patch on. You're going to just pick it up off of your sterile field with your sterile hand, so your dominant hand. And then you can take your non-dominant hand again to pick that line up and put that bio patch into place. You want to make sure that you're touching that bio patch and placing it with your sterile hand and using your unsterile hand to pick up the tubing to help you out. Now you're ready to put the dressing on. You want to pick the dressing up with your sterile hand. You're going to have to use your non-sterile hand to help put the dressing on, but what you can do is you can use the non-sterile hand to pull the paper backing away, because that's not going to go to the patient. You can also hold on the very, very edge with it, because you'll see when you are doing this that the dressing does not come all the way to the very edge. So make sure you keep those fingers to the very edge, and then you're going to put this, you're going to put the insertion site pretty much in the middle of the tegaderm. Smooth that down. Now that the dressing is on, you don't have to worry about keeping one hand sterile and one hand not sterile. You know, you don't have to worry about which one's sterile and which one's not. So you've got that smoothed down nicely. You're going to use this piece of tape here. You're going to put the date, time, and your initials on that. And then that will get, you can peel that up and put that right on the insertion site as well. So now the insertion site has been cleaned, the dressing replaced. We no longer have to worry about our gloves being sterile or not. They've both been contaminated now at the point that we've got this dressing on here, and that's okay. So now that the new dressing is in place, we can go ahead and change the injection caps. And since I don't need to worry about maintaining the sterility of this sterile towel anymore, I can just take these saline flushes with my injection caps and move them over here. Again, making sure the ends of those caps stay sterile. I'm going to move my alcohol little caps over here as well. So again, as you're going to be touching these, you don't have to worry about sterility. It's the catheter itself that you have to make sure doesn't get contaminated. When I'm changing these injection caps, the first thing that I need to do is verify that the clamps are clamped, because I want to make sure when I take this cap off that these are clamped. If you don't, there's negative pressure inside of the chest, and the patient air could actually go into the chest if that clamp is not clamped. So double check, make sure that that clamp is clamped. Now what you're going to do is you are going to unscrew this cap. This can just be thrown away, and this is the part you cannot touch. That will become contaminated if you touch it, if you drop it. You want to make sure that you protect that from being contaminated. You don't need to clean it because it's sterile. You have higher risk of contaminating it if you do. However, if it's crusty and looks dirty, then you would want to take a ChlorPrep scrub and do a 30-second friction scrub on it. This one looks good. So I'm just going to take my new injection cap that has the saline flush attached to it. I'm going to attach that to there, make sure it's tight. Then I'm going to unclamp this. And you should be able to flush it easily. My model's being a little there it goes. Flush a little bit, a couple mLs, and then you want to pull back and make sure you can get blood. You should see blood come into the catheter. Once you see that blood, you can go ahead and flush the remaining saline. Remember, with central lines, you have to have at least a 10 ml syringe. A bigger one's fine, but you have to have at least a 10 ml syringe. A smaller syringe would create too much pressure when you inject it and could damage the tip. If I'm not going to use this, I can go ahead and clamp that back off. But you're going to take the syringe off. You're not going to set this down, and you're going to get your alcohol cap. You should have opened this, opened the seal off of it, either removed it from the strip or taken the seal off of it, and then applied it. Then put that on any unused port. Obviously, if you're going to use the port, you wouldn't be putting that on, because you would be connecting it to your IV tubing. So then we're going to do the same thing with the other one. Make sure it's clamped. Remember that this was the one that I couldn't get that cap off earlier. So what I'm going to do is, before I take that off, I'm going to use both hands and twist that cap off. And then I can hold it so it doesn't become contaminated while I take that one off. Again, I'm just going to simply replace it. Unclamp. There we go. Do a little bit. Pull back. You should see some blood. You just don't on my model. And then flush the rest of the saline. Take that off. And again, apply your new cap. You can see this one has a seal on it here that you need to take off. You want to make sure that that doesn't touch anything. Now, if you were to inadvertently drop that, all you have to do is do a 30-second friction scrub with a chlorhexidine swab before you put the cap on. So if you do drop it, it's okay. Just know that you need to clean that using a 30-second chlorhexidine scrub, and then you can put your new cap on. Okay, there you go. And these are just two different caps, just depending on what your agency uses. You may see something like this, you may see something completely different. And that is how you change a central line dressing. Thank you very much.